Hello, my friend, I am Dr. Dr. Mohammed Chaudhary. Those are patients with me as a doctor, Dr. Sven. Ya Alif Lam Lam. Yallah Shafid Lamapid Lauka. Now, my friend supporter, welcome to medical science class. As a student of medical science, I want to take flavor every branch of medical science. What kind of things they do, that is God, that is knowledge, that is science, that is good work, that is an art. As a Muslim, we are the only educated example of allocation, last and best match in German. Now, medical science class. Gas in abdomen. Gas in abdomen. Common. Everybody say, Doctor, sir, I feel discomfort in abdomen. There is a gas in abdomen. What is the reason? And what is the reason? And what is the solution? The solution, what is the solution? In that position, you when what you eat, that is not digest properly. What you eat, that is not digest properly. There is a problem. Anyhow, either acid secretion or gut enzyme secretion reduce, that can occur. That can occur. And sometimes stool is not come properly. For that situation, stool come properly or not, you first check that. Per day, stool frequency per day, how much time you go to the stool, and per day every day you still stool clear or not. If stool is clear, there is no problem. But stool is not clear. The solution is you go to the so many you go to the other medicine, and in case of tree or plant or plant leaf for that reason. But in that solution for stool clearance, you take spagulahas, 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 subule bushi. Give in water and drink. That's softening the stool come. If stool go, your gas also clear. Sometimes the bacterial overgrowth of bacteria in your abdomen. That is also that is also reason. The bad smelling of stool, so much bad smell. That is on generally how much bad smell present. That is more than that. You understand that by bad smell, you understand that there is so much bad smell, then bacterial growth in abdomen so much. Bacterial abdomen growth so much, that is not spagula has treatment is choice. That is the reason the antibiotic is the choice of treatment. If HCl reduce in that situation, there are so many situations. If HCl hydrochloric acid situation reduce, what happens? If hydrochloric acid, what is the reason? You take so many proton pump inhibitor, omeprazole, esomeprazole, dexlansoprazole. Now HCl secretion reduce, achloride. For that reason, what happens? For that reason, you take liquid, semi-solid, solid. Those food are solid. You take them like soup. If HCl secretion reduce, if diagnosis as achloride diet, HCl secretion reduce. That is called achloride. You see the Now my friend Besata Barada Azan is given. Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar, Ashadu Allah illallah, Ashadu Allah illallah, Ashadu Anna Muhammadur Rasulullah, Ashadu Anna Muhammadur Rasulullah, Yalla Salah, Yalla Salah, Yalla Falah, Yalla Allahu Akbar, Allahu Akbar. Ya Allah, Ibrahim Abba Shashadu Allah, Tumi Buwa, Muslim, Dan Kabeshta, Shabu, Shaman, Tama, Kama, now my friend Besata, you understand that what happened. And in case of situation, that depend on situation. Sometimes abdominal discomfort, gas. Now specular heart, maximum case specular heart can clear. Then antibiotic, those are bacterial overgrowth. In case of achloroheart, that take solid food, liquid, semi-solid, and solid food less. Solid food to, in case of solid food, soup form of soup, you take soup form solid. If achloride, hydrochloric acid reduce. But specular heart is not clear the urine stool, then the executive drug. Laxative drug. What laxative drug? Duralax. Duralax, laxative drugs you take. If take the laxative drug by the permission of physician, by the permission of doctor, your stool clear, gas also clear. That is the common symptom. Common. Everybody say. What is the reason? In case of my patient like Bangladesh, somebody disturbed me. Say, a gas in abdomen. What is the situation? Then I laugh at that situation. They take without permission, doctor personal permission, and omeprazole, esomeprazole, dexlansoprazole. Now HCl acceptation reduce without negligible reason. Take the proton pump inhibitor. Now I also doctor is not aware about that. In case of antibiotic, no need proton pump inhibitor. If give antibiotic, they occasionally give. If give antibiotic, they first give antibiotic with then proton pump inhibitor like omeprazole, then if not work esomeprazole, dexlansoprazole. Antibiotic with proton pump inhibitor or vitamin common. You go to the prescription of the doctor, antibiotic, paracetamol, antibiotic, vitamin, mineral, and proton pump inhibitor. 4 drugs is common. Those are my patients. If your diagnosis is one, try to understand that. If your diagnosis is one disease, if you suffer one disease, one drug is choice. If you suffer two disease, two drug. If you suffer three disease, three drug. Try to understand. Less amount of drug. If give 4 or 5, a single diagnosis 4 or 5 drug, then drug capability and drug transfer by albumin transfer the drug, and drug transfer hamper. If drug transfer hamper, those disease cure 1 week, that disease cure in 2 weeks. Need one drug or two drug. But in case of NSAID, in case of non-steroid anti-inflammatory drug, in that time you not need to proton pump inhibitor, omeprazole. But in that time give NSAID, not give proton pump inhibitor. But antibiotic have no need to proton pump inhibitor. Antibiotic, in case of antibiotic, give proton pump inhibitor. That is the common mistake. So try to understand that, my friend and supporter, and my patient also. And as a patient, you should have right to ask doctor, which drug, what is the reason you give that drug, and what is the mechanism of action, how it cure it, how it work. And also you need, you have need, need. By that drug, in big letter there is a trade name, small letter there is a generic name. Big letter That is the trade name. Small letter there is a generic name. You see the generic name and search what is the mechanism of action. It is correlate to your disease or not. As a patient, you have utilize your IQ. Also for me, if not work, the first dose of first per every disease, the first dose of drug reduce the disease. If not reduce the disease, suppress the disease, you know that that is misdiagnosis, misinterpretation. Go to the doctor. Oh, my doctor, please check up again. My disease condition is not. I take already first dose of drug. My disease condition is not still now same. Go to the follow up. Is it misdiagnosis or misinterpretation? Then doctor check. Oh, okay, okay, fine. Go to the routine examination. What is the routine examination? We discuss elaborated about next class. Thank you very much, my friend, for supporter. Today is an up from medical science class. I am representative of Dr. Momo Chaudhary. Those those patient call me as a doctor. Sorry, those are believe me as a doctor. Thank you very much, my friend, for supporter. La ilaha illallah Muhammad Rasulullah. What is routine examination? Routine examination. Ask a question. Okay, fine. Routine examination. The routine examination 80% equal more or less 80% disease can be diagnosed by routine examination. Pass CBC, complete blood count with ESR, blood test, complete blood count with ESR. Then chest X-ray, then ECG, then serum creatinine, past complete blood count with ESR blood test, then chest test, lung test, chest X-ray, then ECG, then serum creatinine for kidney test, then blood sugar. Blood sugar what is RBS, random blood sugar. That is the 5 routine examination. Equal more or less 80% disease can diagnose that routine examination. If go to the doctor, that is tough to diagnose any disease. That is the reason doctor will commonly given that routine examination. In case of my chamber, you know that there is a checkup and routine examination, fair diagnosis complex also done. That is, you know that equal more or less, if doctor take that per 100 per equal more or less 2000 taka. Doctor also see that first equal more or less 1500 for me, for my patient, and 500 if doctor check that. Total equal more or less 2000 taka for routine examination. What is the routine examination? Complete blood count, chest X-ray, ECG, serum creatinine, RBS. Equal more or less 80% disease diagnosis, that routine. RBS, random blood sugar, RBS meaning 80% disease. Doctor is not doctor. Those are that is vast and tough. Doctor to diagnosis a disease. If first follow up, if go to the doctor is not diagnosis is not correct, then go to the routine examination. If routine examination not correct, diagnose the disease, then go to the further examination to find out the disease. What is the reason? Those are my patient. Also for me, the first dose of drug what I given maybe suppress the disease. If not suppress, come. That is the misinterpretation, misdiagnosis. Try to understand that. Thank you very much, my friend, for today.